And welcome into To Your Health. You may not know this, but in the state of Alabama, we have the University of Alabama School of Medicine. It's ranked in the top 15 of all schools of medicine throughout the country. And in some areas, it's not as high as number 3 or 4. We're very fortunate that in 2014, they brought a campus to Montgomery, Alabama. Today, we have with us the dean of the Montgomery campus of the University of Alabama School of Medicine. We could put Heersink in the middle, but all of our viewers would be going, huh? But it is the School of Medicine. And basically what you're doing here, you're taking doctors that have already got their MD, and they're going into their specialty.
Yeah, well, actually, thanks, Jack, for having us.
You're very welcome.
Here. Yeah, actually, we have the whole gamut of trainees, physicians here at the campus. So what people don't know is we probably have over 30 faculty physicians who practice their specialties, from breast surgery, cardiothoracic surgery, gastroenterology, rheumatology, endocrinology, general internal medicine, and psychiatry, and urology all work here in Montgomery. These are UAB doctors. Mm-hmm. They live here, they work here, they're part of the UAB, and they're on faculty. So that's the first thing. Then we have resident trainees who are MDs, already MDs, but then they're learning their specialty. We have a residency in internal medicine, and we have a residency in psychiatry. And then we actually have medical students. So these are students who are becoming MDs, and they're in their third and fourth years. And at any given time, we have about 30 of those people here. Mm-hmm. So we actually have quite a big operation. We've been in Montgomery since the 70s, so it's approximately mm-hmm. 50 years. The undergraduate medical schools, so the medical students have been here, you were right, since 2014. Mm-hmm. And we've been responsible. We have about 10 of our own students who have come back and are practicing in the community now. And then the internal medicine residency has had many specialists have come back and work here. And we're hopeful. This is the first year of the psychiatry residency, so mm-hmm. we're hopeful that some of them will stay in the community as well. So yeah, mm-hmm. it's actually a big endeavor. And
your physicians are part of a clinic here.
Yeah,
and they're going to see patients. That's what we need to let our viewers know.
Yeah. So for example, the internal medicine clinic, yes. They do primary care for adults, and they actually can take care of people who are quite complicated. You know, internists that do primary care take care of complicated adults or people who are ill, plus also just run-of-the-mill medicine. Mm-hmm. And they are taking patients. They're taking primary care patients. They're available. If somebody needs to get seen, they can get in within about a week. And they're, like I said, that's actually a big deal in Montgomery. It's hard sometimes to get in to see a primary care doctor.
It's a big deal all over, right? Because obviously a lot of times you hear the stories, oh yeah, I wanted to get in to see the doctor. They say I can see him in 3 months.
Right.
Well, in 3 months, you're either going to be dead or better.
I hope it's the second.
Hopefully it's the second that you're going to be better. But at the same time, that's the wonderful thing about it. And obviously, if your physician that you're using right now is retiring, or if you're just looking for a new physician, that's all you've got to do is contact Baptist Health.
Right. And actually, and the UAB Internal Medicine Clinic is and then there are specialty physicians that I mentioned as well, and they're part of the UAB Multi-Specialty Clinic as well. So and if you look, you can find us on the web, and you can actually look at Google UAB Montgomery or UAB Internal Medicine, or through Baptist Health as well.
And you can see a list of every one of the physicians that's a part of the group.
Right, exactly.
That's good. And most of your residents stay here for what, 2 years?
So the internal medicine residency is 3 years. 3 years. So they're here. The faculty. So one of the big, I think, misconceptions is if you were to go and wanted to be seen by the internal medicine doctors, our faculty physicians will see patients without residence. So it's not like you're going to be assigned to a residence clinic. Some people are, and they do a wonderful job, but we also have faculty physicians who see patients one-on-one. And so yeah, so you're able to do that. So the residents are here for 3 years, except for the psychiatry residents, they're here for 4 years.
Mm-hmm. And when we say resident, it doesn't mean you're seeing a doctor.
Oh yeah, so
the doctor is in.
Right. The way it works is somebody goes to college, then they get accepted to medical school. So medical school is 4 years. The first 2 years are science, and then the last 2 years are learning the craft of being a doctor. But they don't just cut you loose and let you practice.
Mm-hmm.
You have to do some training afterwards, and it's between 3 and about 7 years of what they call postgraduate training before you can actually be a physician that has a license and practices. So a resident is a physician who's graduated, has their MD or DO degree, and then is now learning their specialty, family medicine or surgery or OBGYN or emergency medicine or that sort of thing. And so that's what that term means.
Well, we're getting it right from the mouth of the dean, because Dr. Lambiase is the dean of the school. And again, if you need some medical care right here in your own backyard, check with the clinic. They're here to help you. And we'll be right back right after this.